First of all, thank you for giving me the opportunity to make a presentation on assisted reproductive treatments. I am Associate Professor Dr. Serkan Oral. My presentation is Challenges in Health Tourism of IVF Treatments, Solutions, and Correct IVF Treatment Planning. I would like to start by introducing myself. I graduated from the Istanbul Faculty of Medicine 1998, and I completed my specialty training in obstetric and gynecology in 2002. Since 2005, I've been involved in the establishment and management of IVF units in many private hospitals in the field of IVF and as an IVF unit manager. I am a lecturer at Istanbul Haliç University Faculty of Medicine. I've spent the last 19 years of my professional life in the private sector, providing quality IVF services and surgical procedures related to this field. I've been involved in the writing of many scientific articles and books. My professional mission is to offer scientific methods to all patients by combining them with the highest quality of service. The secret of my success has been that patients end the process with complete satisfaction regardless of the treatment outcome. Today, I would like to talk about the problems faced by those working in the field of health tourism for IVF treatment and couples who want to receive this treatment and their solutions. I will also briefly talk about how to make the right IVF planning and new methods that increase the success of IVF treatment. The method with the highest chance of success among assisted reproductive treatments is the in vitro fertilization technique, which we call IVF. Although the abbreviation IVF actually refers to the classical IVF method, many clinics today prefer ICSI, fertilization by microinjection, so the abbreviation IVF can be considered as a definition that covers all techniques. Infertility is defined as the inability to conceive despite 1 year of unprotected sexual intercourse and affects 15% of couples in all societies. This is a medical problem as well as a problem with social and physiological dimensions, psychological dimensions. Couples who want to overcome this problem, if they have no chance of treatment in their own country, if their access to treatment is limited in their country, if treatment success is low in centers in their country, or if the cost of treatment is more affordable in another country, they seek solutions in other country by taking the risk to travel without hesitation. In developed and modern countries, as well as in Eastern societies, where the concept of family is of utmost importance, the search for solutions for women suffering from delayed fertility is a patient and a need that must be met. In a globalizing world, the ease of transportation and expansion of the network in the field of health have inevitably led to the emergence of health tourism. Scientific and commercial partnerships are growing this sector day by day and increasing the quality of service. Turkey owes its success in this regard to its geographical location, its well-equipped doctors and healthcare professionals trained in well-established universities in the field of medical education, and its high-quality medical investment in the sector. In addition to these, there are other reasons why Turkey ranks at the top of the world ranking in IVF health tourism. IVF treatment is a relatively longer treatment compared to other day surgery procedures. Couples who want to spend this time process in another country pay attention to accommodation and place with activities where they can spend time during this travel. In this sense, our country is a very special geography that offers endless opportunities to its guests. High-quality hotel services and unlimited historical and touristic attractions are highly satisfying for its visitors. Istanbul, in particular, generously offers its unique natural beauties as well as its rich historical and cultural richness to IVF patients coming for health tourism. Challenges in medical tourism for IVF treatment. I want to describe these challenges from the perspective of a clinician who has been seeing patients from all over the world for years. I think the biggest problem is in our sector in this regard is communication. The most critical task of tourism agencies, which act a bridge between the patient and the physician, is to form the backbone of this communication. I think that the most important reason for the communication problem is the lack of knowledge about IVF by the people whom the agency assigned to inform the patients. In an environment where the patient cannot get enough answers to the questions she asks about IVF treatment and has a problem of satisfaction in her mind, her relationship with her physician is also damaged. I don't think that an agency official who cannot answer the detailed questions of experienced couple, especially those who have had several IVF attempts, has a chance to convince that couple to undergo treatment in another country. In addition, the desire of agencies to increase patient capacity for IVF treatment is often insufficient. The fact that the process is completed in a short time in other branches, especially in plastic surgery and cosmetic treatments, and that short time travel is sufficient seems to encourage agencies to work more in these areas. In addition, the necessity to find marketing staff with knowledge and experience in IVF treatments or to dedicate a certain number of staff to this field is also a deterrent factor for companies. In IVF treatments, it's a sine qua non that an interpreter who is fluent in the local language must be present to provide detailed explanation and ensure that couples don't have problems expressing their problems to the other part. However, it's not always possible for interpreters to have experience in this field and to be familiar with IVF treatment and related surgical procedures. Another issue is the difficulties experienced by health tourism companies in meeting the right physician and right center. While it's clear that physicians who stand out and become popular with the power of social media are not always the right address, companies are naturally influenced by this populism in the selection of the physician and IVF laboratory to which they will refer their patient. However, the background of the physician, his experience in the field of IVF, and the quality of the IVF laboratory where the procedure are performed are the most important factors of the efficient and successful operation of the business model system to be established in the long term. One of the problems that health tourism companies may encounter for an IVF center in an unfamiliar or new country is the quality of the center's laboratory and the experience of the staff. There are features to look for behind the visible facade of IVF centers, from the location of the laboratory in the city, the ventilation system of the laboratory area, the adequacy of the technical structure, the experience and competence of the embryologist at the head of the center, the anesthesia team, the room where the patients stay in the center, many details should be revealed. Without evaluating all of these, relying solely on the image and rhetoric used by center on social media may result in patient being treated in an underground center. So, what should be our solution for all these problems? First of all, in order to ensure correct communication and create a proper workflow, the Health Tourism Agency should provide services to eliminate language problems. It's very important for patients to be able to express the problems they will face during treatment in their mother tongue, even if they speak English. For a healthy physician-patient relationship, if it has always made our job easier for the interpreter to be a person who can translate the physician's statements one-to-one, listen patiently, and convey them to the patient fully and completely. The agency staff who are in contact with the patients during the initial persuasion process should be familiar with the IVF process and understand the protocols and working principles of the treating physician. The best solution would be for these people to spend a few days with the physician during the agreement process between the physician and the company, and to receive training on the IVF process and protocol use. The process of choosing the right physician and the right laboratory is the most critical for success in IVF treatment. The company official should be competent enough to assess in this regard. The evaluation of the physician's success criteria requires many analyses, analyzing the satisfaction of other patients, the academic background of the physician, her competence, his or her competence is solving problems that require surgical procedure to be encountered in IVF process, the location and quality of the office or clinic where he works, and even whether the physician is presentable should be evaluated. The quality of the hospital and embryology laboratory where the procedure will take place is also a matter of analysis. The quality of the embryology laboratory should be ensured, and the experience of the embryology team should be taken into account. The city where the infertile couple goes to have a child should be safe and socio-cultural appropriate to meet their expectations. One thing that health tourism companies need to realize is that IVF treatments are a profitable and commercially lucrative field. Although the process is seen as a period of 14-18 days and creates a reluctance on the part of the company, considering the infertility rate in the entire population, it's clear that an agency that gains experience and success in this field will not have difficulty in finding patients and will make good commercial profits. In addition, when appropriate conditions are provided, the travel time can be shortened by collaborating with a local gynecologist in the country where the agency is located, and the patient's treatment can be started in her city. I want to end my presentation by talking about innovations and current approach in IVF treatments. The first successful IVF treatment took place in 1978, and a baby girl, Louise Brown, was born that year. Since then, many protocols, technical methods, and treatment modalities have been added. During this period, many studies have been conducted on the safety of the treatment. Studies have shown that IVF treatments are safe treatments without severe complications, and that baby is born with IVF have the same risk as babies born with spontaneous pregnancies. Nowadays, the development and success of freezing protocol have almost eliminated the possibility of ovarian hyperstimulation syndrome, the most important complication of IVF. In my practice, I've never experienced ovarian hyperstimulation syndrome more than 10 years. The PGD, preimplantation genetic diagnosis procedure, which we apply in advanced female age cases and patients with a history of recurrent pregnancy losses or recurrent IVF failure, is an advanced technology method that gives us an idea about the health of the embryo by examining its genetic structure. With this method, we can achieve healthy live births by selecting embryos in single gene mutation patients. In women with advanced age and low ovarian reserve, miraculous pregnancies can be achieved with individualized stimulation protocols. In case of azoospermia, men with no sperm in semen can also have children with a successful micro TESA operation. Stem cell-derived exosome injection, which we apply in ovarian and endometrial failure, have recently entered our daily practice and have given hope to our patients whose chances of success seem impossible. With my experience in laparoscopic surgery and hysteroscopic surgical procedures for many years, I've been supporting my patient with IVF as well as serving them with a high success rate in all these operations. I ensure patient satisfaction by emotionally supporting all couples who want to receive IVF treatment and providing detailed information at every step of the process. I love what I do, and I would be happy to treat the patients you will refer. Thank you all very much for listening.